paediatricians often have a really varied job that falls within two main roles. One is working with and assessing and managing children with neurodevelopmental conditions such as autism, ADHD, learning difficulties, as well as children with complex physical disabilities. And the other is working within statutory roles, that's legal roles such as child protection and looked after children and educational paediatrics. Broadly speaking, I work with children who have got neurodevelopmental difficulties or disability. Or children with neurodisability. So that really is children who have had problems with their development at some level in terms of their speech, their social functioning, their concentration, for example, children with ADHD. And then the second group of children I work with are children with complex neurodisabilities such as complex cerebral palsy and all the additional needs that they have. I work with more healthcare professionals than most people do, but not just healthcare professionals. So I work with lots of different types of therapists, physiotherapists, speech and language therapists, occupational therapists. And outside of healthcare, I work with social workers and the police in the realm of child protection. So on a week-to-week basis, I discuss children with many, many different people. I prescribe a lot of medicines for children. I prescribe medicines for children with ADHD. It's one of my main roles, really, in trying to help with their daily symptoms at school, in terms of trying to help their concentration, for example. And then certainly for children who have got complex physical needs, who have lots of different symptoms like drooling or pain, I try and help with those with medications also. There are many misconceptions about what community paediatricians do. I think often people think that they may be general paediatricians who work in the community, which is certainly not the case. And I think that a lot of misconceptions come about because it's an evolving specialty. So 20 years ago, community paediatricians did a lot of different activities that we don't undertake now, such as routine screening in schools for children's height and weight and hearing. And that's something that's undertaken by nurses. So the specialty has really come a long way, and it really is truly a specialty now in that we specialize in seeing children with developmental problems. So an average week at work from me involves several activities. I do some clinics where I see children in my clinic. I have at least one occasion through the week where I'm probably assessing a child for possible autism, that usually be in a school or a nursery. I have lots of conversations with lots of different professionals that I work with about children who want advice or want to discuss what needs a child might have and what might input into that. And then also on a weekly basis, I partake in discussions about child protection, so giving advice to other agencies about how to try and best protect children who might be at risk from abuse, for example. I think that all parents want to make their lives easier because having children is always difficult, but when you've got a child with additional needs, things can be really tricky at home. And I think my main bit of advice is always to try and reach out. I think in every area across the UK there are organisations that will try and help parents deal with their difficulties, and certainly locally in Liverpool we're very lucky to have lots of organisations, but parents have to try and reach out and be brave and say, I'm finding life difficult and please help, no matter what that help is needed. Why do I do what I do? I enjoy working with children, always have done, and I enjoy working with children with additional needs because I can really clearly see the need that they have for my service.